Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.
So let's kick things off. First of all, I would like to welcome all of you to a live recording of the Skin Sync podcast. We are live from Elevate-Derm Summer Conference in 2025 in beautiful Park City, Utah. My name is Shannon Moranti. I'm a dermatology PA from Naples, Florida.
And I'm Buchanita from the Atlanta area.
And we are so excited today to be joined by another fabulous dermatology PA, Eileen Cheever, from the greater Boston area, who has been in practice almost 18 years and is going to be having a wonderful conversation today about hyperpigmentation. Dun, dun, dun. So this dreaded condition that we all, really see so often in our practices and sometimes struggle with options for how to treat this condition. We would be remiss if we did not thank our sponsors, Beiersdorf. So we are so excited, Eileen, to dive into hyperpigmentation with you. So thank you for being here.
Thanks so much for having me. Very excited to be here.
So let's talk about some of the nuances of really diagnosing hyperpigmentation. Where do you start?
Right, I think it's important to level set that when we talk about pigmentation, we're all reminded that we're not just talking about melasma. Pigmentation often that walks through our door is comprised of a lot of post-inflammatory hyperpigmentation, whether our patients are struggling with it from a dermatitis, a psoriasis, or an acne. But a lot of these patients are struggling with post-inflammatory hyperpigmentation, melasma, of course. And the majority of what we see in clinic is mostly acquired. And once we determine if it is acquired, then we have to find out, is this pigment that is epidermal in nature, or is it dermal in nature? And when we say, is it epidermal or dermal, we look at where that pigment originates from. So if we're looking at epidermal pigmentation, typically we're seeing the presence of melanin and melanocytes. If we're seeing issues regarding dermal pigmentation, we may see issues with macrophages, melanin, or hemosiderin. And then being able to put your hands on the patient and examine them, and then be able to, from an exam point of view, take a look at the pigmentation and let that help guide you if it's epidermal or dermal. So often epidermal pigment will be more of a tan or a brown, and dermal is going to have more of a blue or a gray hue to it. And then everybody, when you get back to your clinic, make sure you know where your Woods lamp is. It's so fun to be able to bring these tools out into our exam rooms. Your patients will love it. It communicates to them that you care, that you want to lean in and investigate what's going on, especially with pigmentation, which can have so much stigma and so much anxiety surrounding it. Plug that Woods lamp in, give it a couple of minutes, little tip and trick, give it a couple minutes to warm up, plug it in, go in and fill out, go see your next patient and then come back. Use that Woods lamp, and that Woods lamp will help guide if it's epidermal or dermal. If it enhances, it's typically epidermal. If it doesn't enhance, that's typically dermal. But it's important to know that a lot of our pigmentation patients may have a mixed presentation, but knowing if the pigment is a little bit more epidermal or dermal will then help guide what your treatment truly is. If pigment is a little bit more epidermal, then you may be able to use some of the cosmeceuticals or topicals that we all know and we'll talk about today. Or if it's dermal, you may be able to use some of those, but you may need to rely on some of your more procedural interventions to help patients. So really deciphering where this pigmentation is coming from and encompassing what pigmentation our patients are coming with is really that first step.
That's such a great point. And it's also, I thank you so much for bringing up the Woods lamp. There's even new dermatoscopes that have a Woods lamp feature built into it, which is really cool.
Exciting.
So thank you so much for that tidbit. I think we'll all be plugging those in when we get home and warming those up. Before we go discuss some new innovations for facial hyperpigmentation, can you review some of the traditional modalities that we've used for hyperpigmentation?
I'm happy to, and I think many listening here today are familiar with a number of the products we use for pigmentation. Many of us are familiar with kojic acid, arbutin, sources of resorcinol, and of course, hydroquinone. And hydroquinone, our patients are very familiar with it. Oftentimes, many of our patients have used it, or they'll come in and they'll request it. And in a setting of proper supervision and patient motivation, it can be a useful product. But I think we all realize in 2025 that there can be hurdles, limitations, and risks with using products such as hydroquinone. And there are mainly two. The first one we talk about is ochronosis, where these patients are using hydroquinone and unfortunately they develop a deepening, a worsening, or a darker shading in the area of pre-existing pigmentation. So they get more pigmentation from hydroquinone, ochronosis. So that's always something we want to watch out for, counsel our patients about regarding the risk. And then the other thing that we talk with our patients about is the formation often that we can see orthoquinone derivatives if we have a patient using hydroquinone. Because remember, hydroquinone is toxic to the melanocytes. So when we see that it's cytotoxic to the melanocytes, that orthoquinone derivative actually causes a lack of pigmentation, leukoderma. The cells have been killed. So we see these bright white patches from hydroquinone use. And we can see pigmentation issues also with kojic acid. There are studies and case reports that azelaic acid can also cause accentuation of pigmentation as well. So these can be effective, but they can also have tolerability issues and risks and warnings that we have to be careful with.
Absolutely. And I've been really excited to talk about this. Let's kind of get into some of the newer advances in hyperpigmentation, because for years I've been hearing about these things that have been available overseas, but we haven't had access to them here in the US. So let's talk about it.
Yeah, so the product that has been used commonly overseas for a number of years and has a lot of research in it, behind it is thiamidol. So when we look at the pigmentation cascade, we know that tyrosinase is the rate-limiting enzyme that's involved in the creation of hyperpigmentation or pigmentation, tyrosinase. So thiamidol is a tyrosinase inhibitor, and it focuses on human tyrosinase. A number of the prior products that I mentioned a few moments ago, their creation and the derivation of those pigmentation treating products was really geared towards its ability to work on mushroom-based tyrosinase. And up until recently, we haven't had a product that has been studied and been found to be effective on human tyrosinase and inhibiting that human tyrosinase. So to be able to have that and limit the role of that enzyme in forming pigmentation without being cytotoxic to the melanocytes, we can use this to improve pigment with good efficacy and really wonderful safety. So typically, you would counsel a patient if, for instance, they're going to treat melasma or post-inflammatory pigmentation from acne, that they would use the thiamidol in the morning in the form of the serum to start in those areas, and then applying their sunblock. And then in the evening, putting the thiamidol serum on again, and then using that nighttime product.
Fantastic.
I have two final questions. One is the halo effect. We see this a lot with the hydroquinone products. Does this happen with thiamidol as well?
So when we looked at two particular studies, first I'll touch upon the use of thiamidol in patients who had acne post-inflammatory hyperpigmentation marks. First, we saw the treatment with thiamidol was superior in terms of fading the marks themselves. And it's important to note in this study, the study participants were patients with skin of color, typically skin Fitzpatrick scores of 5, 6. And that's important because that is reflective of the patients who are usually struggling the most with post-inflammatory hyperpigmentation from acne. So we saw an improvement in the pigmentation, but then we also looked at the pigmentation around the hyperpigmentation. And did we see any lightening around that hyperpigmentation after thiamidol use? And the answer is we didn't. We saw fading of the hyperpigmentation without any haloing around in those thiamidol patients.
So last question, can you review some of the studies that demonstrated efficacy across different types of hyperpigmentation, not just melasma, right?
And I think it's important that we open the conversation today to discuss pigmentation in general, because oftentimes we hear products about thiamidol and you say, oh, that's a product for my melasma patient. But I really encourage you to widen your breadth of understanding regarding thiamidol, because we have studies that show efficacy with thiamidol, of course, in melasma, but we have efficacy with the improvement of solar lentiginase. We also see improvement in post-inflammatory hyperpigmentation marks in acne. And we also see, which is really interesting, using a thiamidol product preventatively to decrease the chance of getting UVB-induced pigmentation. So for instance, you have a melasma patient that you get better, and they walk out of that office and they are so happy and they are so thrilled. And the thing that is most on their mind when they leave is this going to come back? And we know how difficult it can be. We've talked throughout the meeting about how heat and of course UV can stimulate it. But that study that I alluded to actually talked about treating patients before narrowband UVB exposure with thiamidol twice a day for 3 weeks. Then they had the UVB exposure that would typically induce pigmentation. And what they found is in the study, participants that used the thiamidol-containing product and then were exposed to the UVB, they did not have that accentuation of hyperpigmentation compared to the folks in the vehicle. So there's a preventative aspect that perhaps these patients can use serum as a preventative maintenance is really exciting too.
That's fantastic, Eileen. I'm so excited about the fact that this can potentially not only treat, but as you said, even prevent something like this from coming back, because hyperpigmentation can plague patients for decades or potentially lifelong. So it's wonderful to know that when we get them better, they can stay better. How do you typically counsel your patients on sun protection and how important that is?
You know, no matter what disease state that I'm treating as it pertains to possibly sun being an accentuating factor, I'm always encompassing a holistic approach to sun protection. So some of the conversations we've had here earlier in the conference really suggest that patients can minimize their sun exposure and any type of effects from the sun by approaching it holistically. So wearing that sunscreen, wearing a hat, seeking shade, et cetera. So really approaching it from a holistic point of view, knowing their triggers as well. So if heat is a trigger, trying to mitigate that exposure as much as they can.
Yeah.
So exciting.
Love
Very
those head-to-head studies. That's fantastic.
Wonderful.
Okay. Well, Eileen, thank you so much for being here. Thank you for being live at Elevate-Derm in 2025 with us on stage for Skin Sync Live. And thank you to Beiersdorf for the sponsorship of this podcast episode. Thank you all for being here, and I hope you had a good time.
Thanks, ladies.
Thanks for tuning in to Skin Sync. Don't forget to subscribe on iTunes or Spotify so you never miss an episode. We'd love to hear from you. Send your topic ideas to admin@elevate-derm.com. If your suggestion is featured in a future episode, you'll receive complimentary registration to one of our upcoming conferences. To explore more of Elevate's educational and career resources, visit elevate-derm.com.